My name is Amanda Kaufman, and I am the egg educator for Grant County. And tonight our speaker is Dr. Stephanie Hansen. Dr. Hansen is a professor from Iowa State University with an area of expertise in ruminant nutrition. Dr. Hansen's research concerns trace mineral nutrition of domestic livestock and improving feed efficiency in cattle. With that being said, I'm going to go ahead and turn it over to Dr. Hansen. And again, just please mute yourself so that we have minimal background noise.
All right, thanks, Amanda. Can you hear me okay? Perfect. All right, so thank you to Amanda and folks there at Wisconsin for the invitation to speak with everybody here this evening about my favorite topic, which is mineral and vitamin nutrition. I always joke that my my handle on Instagram is Mineral Nerd because that's what I am, and that's my favorite thing to do. So we're still seeing some of these poll results. So I'm going to do stop sharing on that. That's not on my screen. Okay, so I'm going to go ahead and jump right in. I do apologize, I'm kind of recovering from illness, so if I occasionally mute myself so I can cough off microphone, I will jump right back on as soon as I get back. So I know Amanda from her time when she was an undergrad at Iowa State University, and Amanda and I spent some quality time in a 15-passenger van road tripping out west and exploring some of the different extensive cattle production systems out west. And I recall Amanda was our driver on one particularly snowy day in Yellowstone. It was not supposed to snow in May, was it, Amanda? No, but she did a great job. You always need those good Wisconsin kids to drive the van when it's snowing. So, all right, so without further ado, let's go ahead and get started here. All right, so minerals and vitamins are important across all sections of beef production, and I've kind of structured this presentation to talk a little bit about some of what I think are the most important vitamins and minerals, especially as we are approaching spring calving season and thinking about turnout, and hopefully sooner rather than later. And so we'll talk a little bit about cow-calf on that side. And then we'll talk about my end of the business, which is the feedlot sector. And we'll talk about some of our research at Iowa State, kind of the latest and greatest from our program. All right, so why do minerals matter? Why do we care about that? I saw a lot of you use pre-mixed minerals and you're feeding it free choice. So why do you even bother to spend that money per cow or per feedlot steer for your minerals? So what I'm showing here on the screen is really to give an example of that. And so I've got some pictures here. I've got my mineral wheel on this side, which Dr. Loy, if you know him, our director of the Beef Center at Iowa State, always calls this the cat's ball of yarn. And I call this job security because basically we're never going to figure out everything that's going on with this ball of yarn, so to speak. So this mineral wheel shows all the different interactions between minerals. We're going to talk about a couple of those here tonight. But the reason that we care about minerals is what's on the other side of this slide. And that is that you can't throw a dart at a biochemical pathway and not hit a mineral or a vitamin cofactor. They're just really important in everything that your animal needs to do. They're important in immune function. They're important in skeletal development and muscle growth. That's one of the things my lab is really interested in, is how do we help cattle grow faster and more efficiently by feeding them the right micronutrients. We're interested in feed efficiency. Minerals affect things like marbling and ribeye development, so carcass quality gets affected. And then of course, we know that minerals are important in reproductive performance, although we need a lot more research in that area to really figure out specifically what those minerals are doing. Okay, so a couple of things to think about in your own operation. If you see some of the problems that I have listed on this slide, these are a really great opportunity to ask yourself this question: are we deficient in minerals? So one of the first is when you get poor pregnancy rates. So a lot of times producers will be like, well, it just wasn't as good this year as it was last year. I just had a few fewer calves, or I had a few more summer pneumonia cases. And you kind of stop and scratch your head and say, you know, what might be different this year than last year? Well, everything was different in 2020, of course, but, you know, was it a drought year? Was there an intake problem? And so one of the things to think about with poor pregnancy rates is some of the trace minerals like copper, manganese, and zinc that I have listed here. that are all really important in that cow's ovulation and her actually getting bred, especially as she recovers after calving. Retained placenta is a classic selenium and vitamin E deficiency problem, and especially you there in Wisconsin, you have very low selenium soils, and so you're probably very familiar with even giving something like Bosi or Musi, where you've got a selenium and vitamin E injection, because you know that's an important need for your cows there. As I'm starting to think about the spring calving season coming in, and I'm thinking about avoiding those weak newborn calves, or kind of don't like to suck, they don't seem to really have all the brain cells in the right places. And so selenium, and then a couple of the vitamins that we're going to talk about here in a few minutes, things like vitamin A and vitamin E and iodine. These are all things that have been linked to that calf just getting a good start when he's born and getting up and nursing really quickly. Sometimes we think of copper deficiency when we think of kind of that graying around the muzzle or the ears. Those might be some symptoms that we see. That's hard to distinguish sometimes from things like fescue toxicosis or from just shedding out after the winter, for sure, but it is one that we think about. I kind of have a joke here that poor growth minerals are just important in so many growth pathways that it's hard to distinguish between them if you've got a growth issue. But if you are having growth problems, minerals are a good place to start when troubleshooting. And then if you have something like you're deficient in your soils and selenium, that's something to keep an eye on. All right, so as we think about spring calving vitamin and mineral considerations, I just wanted to talk about a few things. My favorite strategy is to put the right mineral and vitamin package into the cow. This is a 2-for-1 situation, in my opinion. Don't wait until a calf is born and try to correct a problem. Try to make sure that, especially in that last third of gestation, when that calf is growing so rapidly, that you are making sure you're really on top of that cow's vitamin and mineral needs. So a few of the things that we're going to talk about here when I think about vitamins for that late stage gestation cow, basically right now, is things like vitamin A and vitamin E. And we're going to talk a little bit more in detail about that in a few slides. But one of the points that I wanted to make here is that vitamins and minerals are a little bit different in how the cow is going to give them to the calf. Okay, so when a calf is born, he is actually going to be born with very, very low vitamin A and vitamin E stores. And that's because that cow actually doesn't have any good way to give fat-soluble vitamins like vitamin A and vitamin E to that baby. So he's not getting any what we call placental transfer. And instead, what that cow is really awesome at is pumping all of those fat-soluble vitamins like A and E into colostrum. So part of the reason that colostrum sometimes is kind of that orangish color is from things like vitamin A in there. And so colostrum is really rich in vitamin A and vitamin E. So it's really important that that newborn calf nurses and gets that colostrum. This can be important when you're thinking about troubleshooting like a dead calf situation with your vet, because if your vet says, oh, they're really low in vitamin A or vitamin E, but that calf was stillborn or that calf never nursed and got colostrum, of course he's going to be low in vitamin A and E because he was born that way. So make sure you really pay attention to whether or not you know if that calf nursed when you're trying to think about troubleshooting something with fat-soluble vitamins. These vitamins are really important in the immune function for both this newborn calf and for that cow to help her recover after that stress of calving and get her ready for rebreeding. A very different situation, but equally important, is trace minerals like zinc and copper and manganese, for example. Okay, trace minerals are actually going to be super low in the milk. And actually, that's totally normal. So zinc and copper concentrations in cow milk are only around like 1 part per million. But that calf has requirements of like 30 plus parts per million for zinc. So milk is actually really low. And so by nature, the cow actually did a really good job of giving those minerals to the calf during gestation. So they have good placental transfer of trace minerals. During the last part of gestation, that fetal liver accumulates trace minerals. So when that baby is born, he's got all the zinc and copper and things like that that he needs in his liver because he knows mom's not going to give him very much in the milk. And he'll actually pull from those liver stores for the first several months of his life until he starts eating the free choice mineral next to mom. He's doing some more grazing and he's starting to rebuild his own stores. So fat-soluble vitamins, it's really important to nurse and get colostrum. Trace minerals, it's really important to make sure that mom got good trace mineral supplementation during gestation, because she's not only getting her benefit from it, she's giving it to that baby so that he can use it later. Just going to talk about a couple of examples as we think about moving into spring calving and lactation here for minerals first and then vitamins. When we think about things like calcium and phosphorus, we're always considering these together. We generally want to have a calcium to phosphorus ratio of no less than 1:1. This will differ depending on your situation. Most of the time, forages are going to have sufficient amounts of calcium, but they may not always be sufficient in phosphorus. This is extremely regionally specific, and so this is a great idea to have a forage analysis conducted that would not only be your classic NDF, ADF crude protein, but also get a mineral panel as a part of that, so you can keep on top of those big macro minerals like calcium and phosphorus that are really important for bone development and also for lactation. The other one we start to think about is one of these days, I know it's early January, but one of these days the grass will turn green, and it might even grow this year. We had so much drought. So I raise cows in central Iowa, and probably like most of you, I've been feeding hay and corn since about July, it feels like, for about the last 3 years. So I'm over that. I'm looking for some nice spring rains, and hopefully we'll get some good cow production this spring. But one of the things that you have to think about when you think about that rapidly growing grass, whether it's the spring cool season grass or it's something with cover crops in the fall, when you get that rapid growth of forage, you think about things like grass tetany. Okay, so what is grass tetany and what happens here? So one of the considerations is that just because the forage might have an adequate amount of a mineral like magnesium in it, does not always mean that the cow is able to use it or that there's not something else in the forage that interferes with it. And this is exactly what happens with grass tetany. So in this case, if you see this graph that I've got here shown some forage here from May out through September. So we would have our cool season grasses growing really rapidly here in May in the Midwest. And what you can actually see is magnesium shown here kind of in this reddish pink line really doesn't change a whole lot throughout this summer grazing period or in this rapid early period. So it's not that rapidly growing grass is really low in magnesium. It's actually that rapidly growing grass is high in some troublemakers, and that is going to be potassium, for example. And the reason that this is a problem is because your cow absorbs magnesium in her rumen. And when she eats grass that's really high in potassium, it basically breaks that process and it prevents magnesium from being absorbed from her rumen. So now, even though all that forage has enough magnesium in it, it's got all that potassium too, and it blocks that cow from absorbing magnesium. Turns out that the cow is not very good at saying, hey, I need some magnesium from my bones or some other place to kind of mobilize and meet those needs. The cow's really good at that with calcium. The cow is not good at that with magnesium. And so if she doesn't have magnesium in adequate amounts in the diet every day, she can become magnesium deficient. And that creates things like grass tetany, because magnesium is important in muscle contractions. And so you get things like the locked up muscles, the irritability and the aggression that can happen with grass tetany. And so this is all happening just because things like potassium, or if you fertilize your grass, nitrogen as well can cause the same interference. And we get low magnesium in the blood for this cow, and she becomes experiencing grass tetany. So one of the best ways to avoid this is to start feeding a high mag mineral at least a few weeks before turnout, and make sure you keep that high mag mineral for that free choice mineral out during that period of rapid growth. The reason that works is because there's actually a second magnesium transporter in the rumen, and when she's getting that high mag in the mineral, she can actually start to use that other transporter and keep her magnesium status where it needs to be, so she's not trying to eat you in the truck every time you come out to the pasture because she's grumpy because she's got grass tetany. So one of the things to definitely keep in mind as we move into spring grazing. Okay, I always like to share this slide because I always get questions about whether or not my cows know that they need some cobalt today and some manganese tomorrow and some zinc on Wednesday. But the truth of the matter is, cattle do not have the ability to balance their own diets. It would be great if they could, right? They would make my life as a ruminant nutritionist a lot easier. But in fact, cattle can't do that. And so mammals like us and cattle, we actually have very little nutritional wisdom. And we'll basically pick the diet that's the most palatable, even if it's not necessarily nutritious. And so my best human analogy of this is it's almost Super Bowl time, right? And if somebody puts a bowl of broccoli in front of you or a bowl of pretzels, you never go for the broccoli, right? Like, you know, the vitamins and minerals in the broccoli, you should eat your broccoli, but you go for the pretzels, and then you go for a beer, and then you go back for the pretzels. And it's because of that salt, right? So it turns out salt is actually what is driving intake of things like free choice mineral, because it's that palatability thing that the cow is consuming. So she doesn't know to go eat some zinc, but she does know that that salt tasted pretty good in the free choice mineral. So I'm going to go back and get some more of that. All right, so let's talk a little bit about some supplementation strategies here. I've got my mineral wheel shown over here again. And basically what this is if there are minerals that are across from each other, they can have potential interactions with one another. Some of those are good, some of them are bad. When I think about supplementation strategies, I really kind of have 3 or 4 main strategies to think about. And I like that one of the questions that you had at the beginning was whether you're offering free choice or top dressed, or maybe even forced into a part of a TMR if you have mixing equipment. So the first one is complete feed. And this is when you're going to add minerals and vitamins into a total mixed ration. I'm a feedlot nutritionist, so in a lot of ways, I'm really lucky because I'm going to mix a complete ration. I'm going to deliver it to a feed bunk, and I'm going to make sure that that steer gets the same amount of nutrition in every mouthful if I've done my job mixing feed and formulating properly. So that's the best way to assure complete intake. And I don't want to give that steer of choice of I'm going to go over there or I'm going to go over here. It's just I'm going to go to the bunk and I'm going to get a total mixed ration. My minerals are included in that. If you think about stalker situations or a time where maybe you're developing, providing a supplement out like on cornstalk residue, you might have a supplement like a distiller supplement that you're providing. You could add minerals into that supplement, and maybe that's a supplement you're giving at 1, 2, 3 pounds per head per day, and you do the math to add your minerals into that. That can be a good way to make sure you get minerals into animals, especially if they have to cover long distances to find a normal like free choice mineral supplementation place. The one that we do most commonly, and what most of you producers here tonight answered, was to offer mineral free choice. And so that is when minerals are basically being offered in a self-feeding situation. And some of the challenges with free choice mineral include the fact that you have cows that want to eat lots of mineral. You get cows that are maybe more submissive and they're less likely to go up to the mineral feeder. You've got calves that are actually in there. So don't forget that calves are actually consuming a part of your mineral as well. So, you know, you have a 4-ounce mineral or something like that, and you're trying to figure out why it's all disappearing. Those calves might be eating a couple ounces of mineral per head per day as they get larger. And a lot of times we don't think about that. So intake can vary considerably among animals when we have free choice. This is my favorite saying in my research group, and that is no mineral is an island. And basically what that means is that sometimes you have to be really careful that you don't make one change and end up causing a negative effect in something else. So just like we talked about with magnesium and potassium affecting each other with grass tetany, a good example in this case might be I might decide to add distillers into my ration, and I realize in hindsight that those distillers are really high in sulfur. And sulfur is a big antagonist for something like copper. So sulfur will bind to copper in the rumen, and it'll cause copper deficiency pretty quickly in ruminants. And so I want to always be considering that if I make one change in my mineral program, that I'm not accidentally creating an antagonism or some kind of problem with another mineral. All right, so one of the questions I always get asked in these types of presentations is, okay, I'm at the farm store and I'm reading my label. A, what are all of these words? And B, should I care, right? Should I pay 25 bucks per bag for something versus whatever, or, you know, $600 per ton versus $800 per ton? How do I decide what I should do? Okay, so these are some of the things that you're going to want to think about as you're thinking about the mineral and vitamin supplements that you provide. So the first question is, what is the bioavailability of that mineral? Okay, so first of all, what does bioavailability even mean? If you think about bioavailability, it's basically the mineral, like let's say copper, for example. It's the copper in that free choice mineral that is going to fight its way through the rumen. It's going to make its way to the small intestine. It's going to actually be absorbed and then used by that cow for something that needs copper. Maybe it's her immune function, maybe it's her support of growth or whatever. Okay, so we want minerals that are very bioavailable because whatever we put into her, we'd like her to absorb and use. So bioavailability becomes important when we consider some of our different sources of minerals. So the two that you're probably most familiar with is inorganic sources and organic sources. And inorganic sources are basically the minerals that are essentially mined from the earth. So things like zinc sulfate or cobalt carbonate. These are the most common source of mineral that you're going to have in any of your products that you might feed. These are generally very water soluble, and so that means they're going to be very soluble in the rumen, which will have a pH pretty close to that. Okay, so that's the most typical. Those are going to be the most affordable. That should be the majority of where your minerals come from in your program. Organic sources are probably something that you're familiar with, whether from educational materials or the local sales guy stopping by. And organic sources are things that are minerals like zinc, for example, that have been bound to something that they would not normally be bound to. So they've been tagged onto an amino acid like methionine, or they've been tagged onto some kind of polysaccharide. And the idea there is that basically if you have zinc and you have its new friend, let's say methionine, so you got zinc methionine, they've bound together, they did this chemical magic. And the idea is that that zinc methionine complex would not become available in the rumen maybe. And so then it couldn't be affected by any antagonist there. So that zinc is kind of protected because of this relationship. So then the zinc gets along to the small intestine, and that zinc is then able to be absorbed and used by the animal. So some of these organic sources, you should be able to have better bioavailability and have more actually get absorbed and be used by the animal. So a good kind of rule of thumb is, especially if you have antagonists in the diet, like high sulfur or high molybdenum or high iron, those are classic cases that are great situations to think about whether you might want to be feeding a mineral that has a little bit of organic trace mineral in it there. You don't need to feed 100% organic. You don't even need to feed 50% organic. In that kind of situation, think about maybe bumping up the inorganic a little bit, and then maybe feeding like 25% of that mineral from organic sources. And those are all things that you can consider when making custom blends, which can be much more affordable than buying pre-mixed packages. But those are good things to keep in mind when you're reading labels and you're trying to say, should I pay X number of dollars more for this product because it's got some of the organic sources in it. A couple of other ways that we can also feed minerals to ruminants. This other kind of category I put on here is the hydroxy minerals, which are, they don't really fall into either the inorganic or the organic because they're actually copper, zinc, or manganese that are bound to hydroxyl groups. So they're a little bit different. And they're weird in the sense that they don't become soluble in the rumen, but they do become soluble in the stomach or the abomasum before they get to the small intestine. So if there's a ruminal antagonism, they shouldn't be as affected by that. So they should be more bioavailable than some of the inorganic sources. The last one that I think is a really unique opportunity in ruminant nutrition is things like injectable trace minerals. And so the bovine liver, the cow's liver, is actually pretty cool in the sense that it can accumulate copper and selenium. So you have to be careful that you don't feed too much of those things because they can accumulate those minerals. But if you have deficiencies, you can really quickly rectify those through an injectable. And so I've actually got a little example here. This is a study that Sarah Hartman did when she was a master's student with me a couple of years ago. This is published in the Journal of Animal Science. And just wanted to show you this as an example of how you would compare an injectable versus feeding inorganics versus feeding some inorganics and organics. So what we did in this study was we had a set of steers And we basically created a copper deficiency situation. So for 90 days, we fed them diets that were high in sulfur and molybdenum and low in copper. And we got their liver copper drawn down after 90 days. So then we said, okay, so if I was a producer and I wanted to quickly correct this copper problem, what are the different strategies that I might use to do that? And so we created 3 different strategies. The first one, shown in yellow, is we basically fed 150% of what the NRC would say for copper. So the copper requirement for beef cattle is 10 parts per million. So in that case, we fed 15 parts per million and only from copper sulfate. So copper sulfate's the inorganic kind of gold standard for copper supplementation. Okay, so 150% of what the NRC required. So we're feeding more here, right? Because we're trying to recover more quickly. I'm going to jump down to the red one here. So this was our blend treatment. So this was the same level of copper supplementation, still 15 parts per million, but 75% of that came from copper sulfate and 25% came from an organic copper, which in this case was Avela copper. So it'd be copper bound to an amino acid. Okay, so all inorganic in yellow, inorganic plus a little bit of organic in the red for blend. And then the black one here is ITM. This is our injectable trace mineral treatment. This is Multimin as the product name, plus feeding 100% of NRC. Okay, so this Multimin has copper in it. And so we took liver biopsies on these steers at the start of the trial, day 14, day 28, and day 42. So basically it's a 6-week-long repletion period. And essentially what you see, if you look at the black line first, the injectable trace mineral, the first time we take a liver biopsy after injection is day 14, and we have markedly increased the liver copper of these steers. So basically, if I would have taken a biopsy the next day after injection, I would have already increased to this because I injected them, so we really rapidly increase liver copper. So this was a really quick way to do that. They maintain this higher liver copper out through day 42. If we look at the blend treatment in red, you can see that on day 14, we're not really much different from where we were on day 0. But by the time we get to a month of that blend treatment, we're not different from the injectable. So after basically 28 days, feeding the organic plus inorganic got to the same point as the injectable trace mineral. So that would suggest that having that organic in there gave us a little bit of a boost. It was more bioavailable and we're increasing liver copper. And then if you look at the yellow line, the all inorganic treatment, you can basically see it takes until day 42 for that liver copper to increase in this treatment. So all 3 of these treatments did the job. They increased liver copper and fixed our problem here. It was just whether or not with the injectable, we kind of did it right away, if we were willing to pay that cost for it. With the blended treatment, it took us 4 weeks. And with the only inorganic treatment, which would have been the cheapest here, it took 6 weeks. So all of these can work. It's just depending on your time frame. Oops, let me back up. Okay, so a few slides here on vitamin requirements before we take a quick break for some BQA questions. So it's time to wake up if you've been taking a nap. So get ready. Okay, so let's talk a little bit about vitamin requirements of cattle. And I've really just picked some of the highlights as we're thinking about spring calving coming upon us. The first one is that cattle are actually really different from some of the other domestic livestock that we produce, if we think about pigs, for example. Mature ruminants need to have things like vitamin A, vitamin D, and vitamin E. Now, vitamin D, better known as the sunshine vitamin, we don't usually worry about that, about animals that are outside grazing or getting any kind of sun or UV exposure. The only time I would worry about fortifying diets with vitamin D for cattle is if I had them completely in confinement. So most of the time we don't worry about that. We are going to talk about A and E in just a second. The other interesting thing is because ruminants are awesome, right? And they have that rumen and the microbes that live there and make our lives so much fun as ruminant nutritionists, is that those ruminal microbes actually make all of the B vitamins that cow needs. And they also make her vitamin K that she's going to be able to use. So we don't generally worry about supplementing B vitamins or vitamin K, with the exception, I'm sure being in Wisconsin, we have some dairy producers on here as well. Sometimes in the cases of really high producing animals, we will fortify diets with things like biotin or niacin or some of the other B vitamins. The other thing that cows are different from humans, for example, is that cows are actually able to turn glucose into vitamin C in their liver. So we can't do that. We have to drink our OJ in the morning to get our vitamin C. But the reason we don't supplement vitamin C to cattle is because they can actually make it themselves. Okay, so let's talk about vitamin A and vitamin E here, just to talk about a couple of the vitamins that I think are really important as I think about spring calving cows. So why do we care about vitamin A? It's really important in things like growth, so fetal growth, for example. Vitamin A deficiencies can be linked to things like abortion and retained fetal membranes or retained fetal placenta. Calf health is one of the biggest ones that I think about when I think about vitamin A function. Vitamin A is really important in a lot of different parts of the immune function. I actually have some research we just found out we got funded from the USDA that we're going to be doing some work looking at some respiratory disease work with vitamin A and zinc with a colleague of mine at the vet school. So we're excited to get started with some of that work. But this is one of the reasons to think about vitamin A in especially gestating cows, because it's really important in immune function. Kind of the classic thing that we think about with vitamin A deficiency is night blindness. If it's really bad in calves, they actually can be born with this like white mucus over their eye, and they actually can't see. The only time I've ever seen that in production was actually in 2013, which was actually after the drought of 2012, when we had a lot of cows wintered on very, very poor forages that winter, and we had a lot of vitamin deficiencies in calves born that spring afterwards. Okay, so I think that this table does a really nice job of showing you what vitamin A looks like in different feedstuffs. And before I forget, I have to acknowledge my colleague at University of Nebraska, Mary Dranowski, who shared some of these vitamin slides with me, because while I am a mineral nerd, Mary is a vitamin nerd. So I asked her to share some of these slides. Okay, so this is actually data from some of Carrie Pickworth's dissertation work when she was at Ohio State. But just looking at some different feedstuffs here and what the concentration of vitamin A is in these feedstuffs. So don't worry about the specific numbers. We're just looking at trends here. And basically want to show you, if you had a 1,300-pound cow, because I'm sure none of us have 1,300-pound cows, right? They're all 1,150 pounds, 1,200, right? Nice little moderate-sized Midwest cow. So 1,300-pound cow, how much vitamin A is she getting from these different feedstuffs? All right, over 500,000 IU per day of vitamin A if she's on nice green pasture. If your cows are out grazing and it's green, her vitamin A and her vitamin E needs are likely going to be met by that pasture, no problem. Unfortunately, at this time of year, most of us are not grazing anything nice and green. We're feeding some sort of harvested forage or harvested feedstuff. If we look at something like silage, this can vary tremendously. So again, feedstuff analysis is useful. Things like hay, it's much lower. And of course, this would be even lower if it was sun bleached or rain damaged, hasn't been stored properly. Although that's one thing, you guys in Wisconsin, you know how to make good hay. So, and then something like straw and wheat, right? It's yellow, it's mature, it's very, very low in vitamin A. Okay, so the NRC would say that a dry cow at this weight needs about 36,000 IU of supplemental vitamin A, and a lactating cow needs about 51,000. You can basically see that really only silage plus some supplementation and definitely pasture are going to meet these needs. So at this time of year, if you're feeding a harvested forage of some sort, it's likely you need to make sure you're thinking about supplementing vitamin A. And this is part of the reason that, kind of tying back to that slide I showed earlier about colostrum versus milk with fat-soluble vitamins, this is the colostrum content for vitamin A versus milk content. And don't worry about remembering those specific numbers. Just notice that that colostrum number is a lot bigger. So it's really important that that calf consumes colostrum to get that vitamin A and vitamin E. The other one is, you can see down here, this is actually calf plasma concentrations. And so you can see when that baby is born, he has very low vitamin A concentrations. But after he's consumed colostrum, look how much higher this has gotten. It's much closer to adult normal. So it's very important that they consume that colostrum. Just going to make a quick note on wrapping up here with vitamin A requirements. Vitamin A and vitamin E are very poorly studied in beef cattle. This is one of the biggest areas where research is needed. Late gestation is going to be really critical when we think about things like vitamin A and vitamin E. And keep in mind that supplementation is going to help you get through this time of year with harvested feed stuff over the winter, only if your cow had good green grass grazing experiences last summer and fall, so she had a chance to accumulate those liver stores after grazing that nice green grass and moving in. If you had drought this last year and you didn't have some green forage in front of those cows, she may already be running out of some of those reserves, and that supplementation rate may not be sufficient. So similarly with vitamin E, fresh grass will really help build up those substantial stores, but don't assume that's adequate if we've had years like this last year where we've had drought. We know, I'm not talking about it very much here, but I just wanted to reiterate, vitamin E is really important in newborn and young calf health. And this is one of those ones where it's really important, not only in helping the cow bounce back quickly after parturition or after calving, but also getting that calf off to a good start with his health. So I think we're going to switch gears here. So I'm going to let Amanda jump in here with some questions.
Yes, guys, we're going to go ahead and do a quick poll question. And while Sandy is getting those pulled up, we do have some quick questions to cover that we'll cover in the chat box. One is, hold on, I have to move this a second. One is, I use Multimin 90 for my calves at 3 months, and I put minerals also in their feed. Am I overdoing it?
Do you want me to try to answer that, Amanda?
Yes, if you would.
Yeah, so I think Multimin at 3 to 5 months, like kind of what we consider branding time out west and things like that. If I had to think about putting it into a calf, I like that time point. I think that's a nice point where they're kind of transitioning from having had lower, or they're starting to burn out some of their liver stores before they move on. I wouldn't necessarily worry about that being too much because your dosage is going to be pretty low. It's maybe only 2 or 3 mils at those little calf kind of weight at 3 months of age. I think the number one thing to think about when thinking about stacking mineral supplementation things is things like selenium. If you're in an area where you're selenium deficient and you're using an injectable selenium and a fortified selenium product or a couple, be really careful because the liver of the cow is very good at accumulating selenium, and that can become toxic. So to me, I think selenium is the number one to keep an eye on for those types of things.
All right. So just a reminder, everybody, if you could please fill out the poll question. And then the second question we have while they're finishing up that is vitamin A in 5 to 6 inch sprouted barley?
I don't know. Hold on a second. Let me ask my friend. Is vitamin A in 5 to 6 inch sprouted barley? Mary happens to be here today, so she says if it's green, yes.
Thank you. So if we get a few more people to answer the poll. Oh, okay. So the question was, which fat soluble vitamin is most likely to be deficient in the Midwest cow herd? And the majority of you got it right, vitamin A. So good job to the majority of you. All right, and we'll hop back on into the feedlot side of the presentation.
All right. So if you have never had a chance to come to Ames, this is our feedlot here. And so this is 6 head pens for our feedlot facility. And way down here in what feels like the next county is our working facility. All right, so I'm going to talk about 2 main areas of research that we have going on in the feedlot at Iowa State for our research. One of those is going to be stress, and one of those is growth promoting technologies. So when you think about stress in the feedlot, we think about things like the weaned calf and then trucking that calf, giving that calf new friends at the sale barn, bringing him to a feedlot, then maybe we vaccinate him and we give him a diet he's never seen before in his life. And we still expect him to eat, drink, gain for us and mount an immune response to that vaccine or any disease challenges. So I have a couple of students who are interested in this idea of stress in the feedlot. So one of the studies that this student did, so this was some of Erin Dieter's PhD work, and she was interested in vitamin E in receiving cattle. So I'm just going to show a couple of slides from a couple of different studies just to kind of talk about some of the importance of vitamins in the feedlot here. So this is a group of cattle that we got from a Nebraska ranch, Angus-based steers, about 200 head, weighing about 550 pounds. And we basically assigned them to one of 4 vitamin E treatments. Either no added vitamin E in the diet, what the NRC would suggest is the vitamin E requirement for cattle, then what maybe more of a stress vitamin E supplementation level might be at 500 IU per day. And then what we would consider a pharmacological or a high dose at 1,000 IU per steer per day. Okay, so just going to show you a couple of graphs from this. So this was our 4 treatments, basically control, low, medium, and high. This is serum vitamin E and liver vitamin E. These kind of hashed bars are where these steers were when they first arrived. And Erin has helpfully given me some kind of metrics here to show you that anybody below this line would be deficient, kind of between here would be minimal, and anything above here would be considered adequate. So you can basically see that these steers that just came off of grass at weaning in the fall, this was October of a few years ago, were basically minimal to borderline adequate on serum vitamin E. And then 30 days after supplementation, or 26 days later, you can basically see the black bars there, our final serum, and we linearly increase serum vitamin E in these steers, and both our medium and high treatments are above adequate here. And similarly, when you look at the liver, you can see they all came in at pretty decent stores, but in this treatment here that did not receive additional vitamin E, they've actually dropped their vitamin E over this 24-day period. So what this says is that when calves come in off fresh grass, they're probably coming in with adequate vitamin E status, but if we don't provide some of that in the diet, we've got the stress of immune response after weaning, etc. He's actually dropping his vitamin E stores in that first month of life, and he wouldn't then have those potentially available to help with things like an immune response. Whereas those that got what the NRC recommends, or medium or higher concentrations, are linearly increasing their liver stores of vitamin E, potentially to use later. The only data I'm going to show from this slide was one that I wanted to talk a little bit about immune function. Immune function is kind of this really vague concept, like what does that mean, right? It should mean if I give some of these micronutrients to my animal, they're ready to mount a better immune response. So in this case, we actually gave them a bovine viral diarrhea virus antibody. So kind of something we would typically find in some of like our 5-way vaccines. And basically what we see, if you look at this last line, 26 days of the study, this is 20 days after we gave them this booster, we linearly increase antibodies. So the more antibodies you have, or the more antibody these calves have, the more ready they are to have a good immune response if they were to see this particular virus. So we want this to increase. Not too much, but we want to see an increase. And we see a nice increase due to vitamin E. And this supports what we see in the literature, and that is that higher concentrations of vitamin E in receiving cattle might help with immune responses. So that's something to think about when you think about receiving programs. So one of the other things that we're interested in at Iowa State is transit stress. And so I mentioned earlier that cattle make vitamin C. So there is almost no research, with an exception of a couple of studies actually from University of Wisconsin from Dan Schaefer, very few studies done with vitamin C. So we wanted to look at what would happen if we gave cattle an injection of vitamin C before or after a long haul trucking event. So what we have in this study is 24 steers per treatment, Angus-based steers weighing about 670 pounds. And these steers got to go on an 18-hour truck ride around the state of Iowa. And they never get to leave the state of Iowa because Dr. Hansen always forgets to get health papers before the transit studies, so they can't leave state lines. So our truckers get to see a lot of whatever's happening in the state of Iowa that month. So we took these steers and we basically either gave them saline before and after the trucking event, a vitamin C injection before trucking, or a vitamin C injection after trucking. Okay. And this is why we did this. So one of the things that we know that happens when we truck cattle is their antioxidant status drops. So antioxidants are things that help support kind of the typical metabolism that happens in the animal. And so we don't want this to drop, but this is actually a marker of antioxidant status. And in cattle before trucking, they're at about 300 here. And after trucking, or 330, excuse me, and after trucking, they've dropped to 300. And then within 24 hours later, they recover. So cattle are very resilient. We know that they recover really quickly. But we were wondering is, well, what if we try to interfere with this? Maybe this is a bad thing. Maybe we don't want them to have this big drop in antioxidant status. So vitamin C is a really potent antioxidant. So when we gave these cattle injections of vitamin C, we actually see that we're able to increase their plasma vitamin C. So the group here in red is the group that got vitamin C injection before trucking. So they actually increase because we gave them an injection of vitamin C, and they kind of stay that way through 24 hours after trucking, and they eventually come back down to baseline. This is a water-soluble vitamin, so they'll eventually excrete it. But for the two treatments that got saline before trucking, their vitamin C dropped by about 15% here during trucking. So this shows that vitamin C status is decreasing when we truck them. And then in the yellow is the steers that got vitamin C when they got off of the truck. So kind of a like, I couldn't give it to them before they trucked. Let's just see what happens when they arrive back at the feedlot, and I could give them a chance to give them that injection. And you can see here that they really then increase their vitamin C and are able then to keep it higher out until this day 7. Whereas the guys in the saline group, they do have a little bit of recovery naturally, but they never get as high as these other treatments. Okay, so these vitamin C injections only cost $1 per head, so it was pretty affordable. And we saw tremendous performance response. So the first thing we noticed is that feed intake by these steers, whether they got vitamin C before trucking or after trucking, was improved versus those cattle that did not get any vitamin C. The other thing that we noticed is that if those cattle got vitamin C before trucking, they gained quite a bit more during a 56-day period after this trucking event versus those that got saline or even those that got vitamin C off truck. So the moral of the story here was that getting vitamin C before trucking helped to prevent that decrease in antioxidant status and seems to be positive when it comes to looking at their performance. Interestingly, in that study, even though it was only a 56-day receiving study, we put those steers on a different finishing trial, and Aaron tracked those steers out through their hot carcass weight. This would be like 150 days later after that trucking event, and they actually maintained a lot of that performance benefit. We can actually see that those steers that got either pre or post actually tend to be heavier on hot carcasses than those that only got saline before trucking. So there was some carryover effect of that vitamin C. Okay, so we saw in these studies that both plasma ascorbate and antioxidant status were decreased by trucking. And so in this study, we saw a positive effect of vitamin C injection before trucking on performance. And like I said, these doses only cost $1 per head. So it was pretty easy to give. All right, so in this last little section, I want to wrap up with talking about my favorite subject, which is mineral nutrition for modern beef cattle. So it is fascinating to me how much we have done in this industry between genetic improvement, the management practices, animal husbandry, and the growth promoting technologies that we have available in this industry. We have increased the average daily gain of cattle by almost 50% since the late 70s. It is tremendous what this industry has done. What we have a very little understanding of is whether or not the mineral requirements of those cattle have changed. So this is one of the things that my research lab is very interested in. Okay, so why would we maybe even care about whether or not mineral requirements have changed? Well, one of the things that's really interesting to me is that if I just look at a typical corn and corn co-product diet, this would be things like distillers and dry rolled corn with a little bit of corn silage or hay, I actually see that that diet in general, if without supplementation, is very low in trace minerals. So our diets in this particular situation only analyzed 2 parts per million of copper, and the NRC says that we require at least 10. And zinc, we only analyzed 15 parts per million. The NRC says we need at least 30. So the moral of the story is consistent for most of these, is that our diet that's kind of corn-based is too low in trace minerals relative to what the animal requires. We also have what the industry, feedlot nutritionists tend to formulate. That's what I've got shown over here. And right or wrong, they tend to feed 2 to 3 times what the NRC recommends. All right, so we did a study a few years ago. This is part of Emma Niedermeyer's master's work, where basically she had cattle that were either not implanted or cattle that received a combination in moderate potency implant followed by a high potency implant. And she fed either no supplemental trace mineral, what the NRC would recommend, or what the industry feedlot nutritionists report feeding. And this is our profitability shown up above here. So these cattle were sold in January of 2017. Boy, I wish the cattle I was selling now would be making 140 bucks a head. Not so much, but we're going to get there eventually. Basically, what I'm showing here is that if we did not implant those cattle, which are those first 3 bars, they all lost money. If we implanted them but did not feed them trace minerals, they still lost money. If we implanted them and fed them what the NRC made, or what the industry feedlot nutritionists report that they feed, we made money. So both implants and trace mineral supplementation were important for profitability here. So we've kind of been chasing that since 2018, and that's where I'm going to wrap up with these last set of slides here to talk about 2 of the minerals that I think are really important when thinking about for feedlot nutrition. Number 1 is zinc, and so we'll talk a little bit about zinc here. This is some data from Elizabeth Messersmith's PhD work. And Elizabeth had steers that she either implanted or did not implant. And so the implanted steers are shown in this dashed line, and the non-implanted steers are shown in a solid black line. They all would have received their respective treatment on day 0. And these data are plasma zinc concentrations. Okay, so it's hard to move plasma zinc. Very few things will change it. It's actually a terrible biomarker for zinc. It never changes except for when animals are super sick. Or it turns out when animals are growing really fast. So what we actually see, and we've seen in multiple studies, is that when we implant cattle, we drop plasma zinc by between 10 and 20%. And I actually just got a USDA grant to follow up on some of this and figure out what's happening. But what this says to me is that when cattle grow really fast, like they do when I implant them, we're starting to pull their zinc from circulation because muscle is using it to grow. So we know that maybe these steers would potentially have a growth response if we feed them more zinc. And spoiler alert, I'm not showing some of those data, but we do see that. Some of the data that we've looked at with other growth promoting technologies besides implants has been with things like Optiflex, so ractopamine hydrochloride. And we have basically seen that as we increase, don't worry about the treatments here, this is basically increasing amounts of zinc from left to right. We basically increase average daily gain of cattle when we feed them Optiflex and more zinc. So what this says to us is that, of course, when we feed cattle a beta agonist like Optiflex, we expect to see an increase in rate of growth. We know that zinc is really important in protein production. And so what we have seen in some of our studies is that actually zinc and nitrogen retention or protein retention in the carcass, basically muscle growth, are positively correlated. So the more that animal is going to lay down muscle, the more he's going to grow quickly, the more zinc he needs to support that muscle growth. All right, so I always like to show zinc and copper here because they're kind of 2 sides of the coin. Our research so far would suggest that we probably need to feed more zinc than what the NRC currently recommends, and that's where a lot of our research is going. However, we think that the NRC is probably pretty spot on with copper, and that when the industry recommendation is more like 20 parts per million of copper, that's too much copper. I don't think our beef cattle require that much copper. We don't need to be spending that extra money on supplementation. And I'll show you a couple of slides here to wrap us up to show you what I mean. So this was a study looking at cattle that either did not get a beta agonist or did get a beta agonist at 300 milligrams per head per day for Optiflex. Again, part of Elizabeth's PhD data, or actually her master's work here. And essentially we have cattle that we fed no supplemental copper to, they're shown in gray. We fed them what the NRC would recommend, shown here in yellow, orange, probably gold, right? This is state color, so cardinal red and gold here. And then here in our red is our industry supplementation. And basically, if you look at these two bars in the middle, if we fed ractopamine to these cattle that we fed NRC amounts of copper, we had a 22% improvement in average daily gain during the ractopamine feeding period. So very typical response. But if we fed higher amounts of copper, we only got about half of that average daily gain response to a beta agonist. So we were actually suppressing some of that growth response. And then really interestingly here, if we fed no supplemental copper, it was like we didn't even need to feed that beta agonist. We saw no growth response to it at all. So there's something really interesting happening in this interaction between copper and beta agonists. We've also seen this with implants in kind of similar things where feeding cattle no supplemental copper or feeding cattle high levels of supplemental copper, we actually see that the implant response was actually a little bit better in our not supplemented group versus those that we fed higher amounts of copper. So we think that when we feed some of these higher amounts of copper, we're actually interfering with some of the biology in some of the implant response, and that's actually suppressing a little bit of that performance. All right, so we basically so far are seeing that rapidly growing cattle likely need more zinc than what their current recommendations are. We think that the current recommendations for copper are very adequate, and going above that may actually be detrimental. And we know that minerals are important for supporting growth, health, and reproductive performance of beef cattle. So we'll just wrap up here by saying, test your feeds, test your water. We haven't talked a lot about water, but it's really important to think about what your water quality looks like, especially when you think about things like iron or sulfates. And start a conversation with your nutritionist or your extension specialist there in Wisconsin to help optimize your mineral program. And with that, I would be happy to answer any questions.
All right, so before we do that, we're actually going to do a poll question. And while Sandy is pulling that up, we will go back to some of these questions. Has there been a study of VC oral intake, not intramuscular injection?
Yeah, that's a great question. So one of the reasons that we like the idea of the injection is because, well, two reasons. One is that if you feed a oral vitamin C that is not ruminally protected, you're basically just feeding very expensive glucose to the microbes in the rumen. So you've got to have something that's ruminally protected, or the microbes are going to eat it all and the cow's never going to get to use any of it. The reason we like the injectable vitamin C, I realize there's a handling, concern with that. The reason we like the injectable vitamin C is because the muscle is actually pretty cool at soaking up vitamin C and keeping it to be able to use it for a little bit later. So we think that that's some of the benefit that's happening there. That's a great question. We've done some research actually with oral vitamin C and some of the high sulfur diets, and we have seen some improvements there, but the products are pretty expensive and it's hard to get that intake at the right time.
All right, thank you. Another question we have is, in the vitamin C trucking study, the animals were exposed to a fairly long in-trailer time. Does this effect also show up after short treks?
Yeah, that's a great question. So we're actually just wrapping up some research where we looked at 8 hours versus 18 hours like we did in that first study. And so we have some of those results so far. Actually, in that study, we don't see much of a vitamin C effect. I think the person asking the question is onto a really great point, and that is that the longer the haul, the longer the stress, maybe the more likely to see benefits from something like a vitamin C injection.
And then going back to the question, the prior question, they commented that they were thinking of feeding pumpkins.
Okay, so thinking about different, yeah. So it's going to be the same answer because that vitamin C that would be in any kind of feed stuff, if it's available in the rumen, the microbes are going to use that vitamin C, and there wouldn't be as much that potentially would get to the small intestine to be absorbed for that use.
So just to remind everybody, please fill out the poll question. So another question that we have is, what would cause too much zinc? This producer had an autopsy done on a calf with really high zinc.
So it's a great question. So if it was a very young calf, like say less than 60 days old, for example, it would be very normal to have very high liver zinc. When that calf is born, because of all that fetal liver accumulation that's occurred in the last third of gestation, his liver zinc will be maybe 2 or 3 times higher than it might be compared to an adult. So it's really important that your vet is looking at the right reference ranges for the age, whether it's a newborn reference range or an adult reference range. So that's one possibility. The other thing, and this is a great question to bring up too, is that you have to be very, very suspicious if you're ever looking at animal tissue analysis from an animal that's been dead or an animal that was sick before he died, because the immune system is actually going to move zinc out of the plasma and into the liver as a part of the typical immune system response. So if you have a calf that's maybe been sick for a week or two with, like, say, respiratory disease, and he dies and you post him and the vet says, hey, the liver's really high in zinc, I would be very suspicious that there's actually anything wrong with zinc. That's just a normal immune response to dump that zinc into the liver and get it out of circulation for that animal. That's a great question.
And just want to put one more plug in, guys. If you guys want BQA credit, please fill out the poll. All right, we do have another question. If there is a lot of iron in the water, what minerals does the iron antagonize with, and what is the best method to counteract this effect?
Yeah, that's a great question, and definitely one that you guys probably deal with up in that neck of the woods. This is actually part of my master's and PhD work. Iron antagonizes manganese, and that's actually one of the problems that we've been seeing more of in recent years, especially iron coming from soil contamination of corn silage and things like that. But iron in the water can affect manganese in the animal, so that's one of the things to think about for supplementation programs. There's some different ways to get iron out of the water. Some of them are some peroxide treatments and some different kind of in-water treatments. You should be able to talk with your extension folks or talk to others in the area to be able to figure out some different programs for that. Classic signs of iron can be when you have like kind of that orange slime looking stuff that kind of sits around the water and things like that. The other one can be if you have like a black precipitate in the water, so like chunks of black that's in there, that can be manganese or iron that interacts with sulfur and it kind of precipitates out as those black chunks in water.
Thank you. Another question we have is, are the organic minerals called biomass?
So biomass would be a kind of an additive type that would be available. I think that's Alltech's product. So organics are going to be marketed under lots of different ones. So like the Zinpro line would be like the Avela Copper, Avela Zinc. Chemin would have organic products, lots of different companies. So look for things like an amino acid in there. So like a glycinate or a methionine or something like that is how you're going to know. So basically, if it's not sulfate, oxide, or carbonate, if it says anything else like lysine, methionine, polysaccharide, some other weird word, those are more likely to be the organic.
Great. The next question is, my black Angus beef cows get a reddish look to them in the summer. I was told it is a mineral deficiency. Is it, and which one could it be?
So if it is, it's probably copper. However, keep in mind that sun bleaching, I raise Black Angus cows too, and I'm pretty careful about my mineral program because that would be embarrassing. Um, and they get reddish, tints, and they'll get red on the tips of their ears and things like that. I would say a more obvious copper deficiency sign is when they're starting to get gray, so gray around the muzzles. Copper is actually important in pigment production. And so the reason that they have that black hair coat is in part because of copper. So if it's deficient, it'll start to get more like a gray color. So it could be more likely just, a summer shedding out kind of thing. But if it is a mineral, copper is the most likely candidate.
And another poll question was just pulled up. So please answer if you are BQA certified and would like us to send you the credits. The next question is, did you give only one injection of multi-min? I'm assuming they're talking about your previous study.
Yep, exactly. And so those steers, so there would have been just the one injection on day 0, and those steers would have been, I'm pretty sure they might have just hit the yearling mark in that study. So that would have been 1 mil per 150 pounds of body weight.
Another question is, are there benefits of using apple cider vinegar as a water supplement?
That's a good question. I don't have an answer for that one. I would think about pH with something like that. When I think about vinegar, I would always want to be careful about pH because that rumen is so sensitive to changes in pH. And if you're feeding something with like a vinegar, you would have a pretty low pH. It'd be pretty acidic. So I'd be very concerned about keeping an eye on so the microbes don't like changes. They don't like any changes. And so if you change the pH for something like that, you could have an upset rumen.
All right. Can water high in iron cause infertility? The person who answered this question says their water has an orange tinge to it, I believe is what they're trying to say.
Yeah, so the things that I think I forgot to mention copper before. I mostly focused on manganese, but high iron can also decrease copper status in cattle. And both manganese and copper are really important in fertility. So they're important in early embryonic maintenance of pregnancy, and also important in just kind of embryo quality things. So yeah, I do think that in cases of high iron, you could potentially have fertility issues. The bigger challenge too is that cows don't want to drink water that's high in iron. So you've got to be careful just about water intake challenges if you have very high iron in the water.
All right. Another question is, any thoughts on feeding probiotics, and does it increase vitamin C production?
So probiotics are tough just because well, a couple of things. We don't have a really great idea of how they're actually working. Also, they're kind of vaguely named, right? We lump a bunch of things into this term of probiotics. In some cases, they do seem to be beneficial. And the theory there is that they're actually causing some changes in the rumen, to the sense that animals kind of have an early adaptive immune response. So they're more ready to have kind of a quick immune response when they see a disease challenge. In other cases, they've talked about maybe better diet digestibility, nutrient digestibility when they've used some of the probiotics. I would say that if you're thinking about probiotics, ask to see scientific data that would show the comparison of that probiotic versus animals that did not get it, to see if there was an improvement in feedlot performance or receiving calf health or whatever your particular interest is.
All right. And then I think the final question we have at the moment is, do you recommend multi-min in newborn calves?
So I would rather see a producer give multi-min to that cow 6 to 8 weeks before she calves, rather than putting that 1 cc into that newborn calf. And my main reason for that, especially if you can time it with like a scours vaccine or something like that, right, when you're going to be working that cow anyway, is that she gets the benefit of it, right? And she'll be more ready for calving. She'll be more ready for, particularly with cows with trace minerals, I like to think about their recovery period. So the faster I can get her to recover after calving, the better she's going to be prepared to be ready for breeding. And so I would rather see somebody put, if they're going to use multimin, put it into the cow 6 to 8 weeks before calving, and then don't mess around with that newborn calf at all, because that cow is going to have delivered that mineral to that calf in utero.
And then we had one more person put a question in the chat. Any data about improvements in health using vitamin B6 and B12?
Okay, so a couple of comments. So I haven't seen much on B6. So B6 is really important in protein production, or protein metabolism in the animal. Overwhelmingly on the beef side, I would say let the microbes do the jobs for the B vitamins. I wouldn't worry about supplementing most of the B vitamins for beef cattle. We just don't have enough research on that yet. B12 is actually very different in ruminants than it is in other species. So if you were going to give B12 to cattle, you would actually have to give an injection of B12, because you're actually going to feed cobalt to your animal, and the microbes are going to turn that cobalt into B12. It's actually this super cool vitamin that has a mineral at the middle of it. So you feed cobalt to the cow, her microbes turn cobalt into B12, she absorbs that B12, and then she uses B12. So microbes need cobalt, cows need B12, which is always my favorite question in 419, my advanced nutrition class. So if you were going to give B12 to cows, you'd have to give it as an injection, because you wouldn't necessarily feed it as B12.
All right, and then what kind of changes do you need to use in mineral using high moisture grain to finish cattle?
I'm not specific that there would be any particular ones that we would change. So lots of feedlots would feed, 50-50 of high moisture corn and dry rolled corn to be pretty typical in this part of the country. And we would see, improved performance over just feeding dry rolled corn with something like that. When I think about finishing cattle, zinc is the #1 trace mineral that I think we are currently underfeeding based on what the NRC recommends. I think we can safely increase that, maybe to 60 to 100 parts per million, where the NRC recommends 30 currently. The other one is zinc's pretty low toxicity, so I don't worry about that too much. Yeah, I think zinc is the #1 that I would think for that. I don't think I would really think about any other major concerns that I would feed anything differently with that versus if I was just feeding dry rolled corn or even steam flake corn.
All right, and then another question we have is, I see sometimes animals eat their wool grooming a lot. What would that be a problem of, or be due to a mineral or vitamin deficiency?
So a lot of times when animals are doing things like, self-grooming or allo-grooming, which is grooming another animal, is actually thinking about some of the behavior issues. So whether they're, are they bored? Is there a dominant boss cow problem? Something like that. Would probably think about some of those kind of problems before I would think about a mineral or vitamin deficiency. Now, if it's something where like they're eating the limestone, we had a case where somebody called us and was like, my cows are eating the bottom out of my shed, basically, and they were eating the limestone, and they were calcium deficient, and they were solving their own problem by eating the limestone. Or thinking about like eating lots of dirt, like pica or something like that, which can be a phosphorus deficiency. That's a little different, I think, from thinking about just like excessive grooming or things like that.
Few more seconds left on the poll, guys. If you haven't already, please go ahead and answer the poll on if you are currently certified in BQA and if you'd like us to contact you for continuing education credits. One person did ask as far as the vitamin ball of yarn, if they could receive a copy of that and what it represents.
Yeah, so that's the mineral wheel. You can actually just Google mineral wheel and find lots of different versions of that. The mineral wheel is really just a good way to help you see that you don't want to make just one change. Like, so you don't want to just change zinc and not consider the fact that zinc might have an interaction with another mineral, or not just change calcium and not think about how it interacts with phosphorus. I'm a mineral nutritionist with several years of training in that, and I don't know what the mineral wheel means. So I don't think for producers I would worry about getting down into the weeds with that. I just want you to understand that you don't want to just think about one mineral at a time. They do have some effects on each other.
And then if you want to prolong the animal to wait on markets, on market dollars with a high forage, is there any changes you need to make?
So thinking about doing like backgrounding before bringing them into the feedlot maybe is how I'd interpret that. So when I think about forage-based versus grain-based, I don't think as much about mineral and vitamin changing for that when I think about feedlot animals as I do about rate of growth. So if you think about the feedlot animal and kind of his growing period where he's putting lots of muscle and he's still growing his skeletal frame, it's going to be important that he has adequate things that support bone development. So things like calcium and phosphorus, but then things like zinc and copper, which are going to support his ability to put down muscle. Then if you think about him during the finishing period, he's not really putting down new bone. He's still growing some muscle, but he's now putting down some more fat. That is a time period where we might eventually be able to maybe back down a little bit on things like copper. We might want to make sure we increase zinc a little bit to support some of that growth. But I would say at this point, I don't think we have enough information to say really how growing versus late stage finishing cattle really differ in their mineral requirements. That's actually one of the things that my lab's really interested in trying to titrate.
And then another question is, what water tests do you recommend?
So I like to think about sending things, so like a water bottle size kind of sample from a well. If you've got multiple wells or multiple sources of water, thinking about making sure that you test those different sources of water. Midwest Labs has a nice water panel. Lots of labs have good water analysis available, but you can look at things like you should be able to see total dissolved solids, hardness, pH, and then usually they'll have things like some of the minerals in there like sulfates, iron, manganese would be some, calcium, magnesium would be some of the classic ones as part of that.
All right, and then let's see. When feeding free choice minerals, do you recommend loose, over poured tubs or pressed tubs?
I do like loose over tubs for a couple of reasons. And the main one is really intake. It's so hard to know, you either get a tub where a cow has to just lick and lick and lick, or you get that cow, I don't know, I always had these cows, right? You could just like bite a huge chunk out of it and walk away, right? So, and it's, this is another one where you've only got little areas, right? Because you've just got so many tubs, and then you've got dominant versus submissive cows who don't always want to be there at the same time. The thing about free choice and having a loose intake mineral is, number one, just keep a notebook or something in your truck and write down how much mineral you put out when you put it out. You don't have to have it out there every day in front of them, but just keeping track of it will help you realize maybe you need to do something like get a mineral that has a little more salt in it or a little less salt in it. Maybe you need to move that free choice mineral feeder further away from the water to decrease intake. Maybe you need to move it closer to the water to increase intake. Maybe you need to have a couple of different feeders out there so that you can have the cows kind of equally spread out there. I do like loose in part because you can just monitor intake a lot more closely.
All right, so if you have more questions, please continue to put them in the chat box. We are going to go through our finishing slides. So if you have any questions about anything covered tonight, please feel free to reach out to myself, Bill Halfman, Carolyn Eady, Ryan Sterry, or Sandy Stitchen, and we can help connect you with some possible answers. We also wanted to point out or give you a heads up that the Driftless Beef Conference is coming up January 26th, 27th, and 28th in the evening. We have some fantastic topics just to name a few, there's a sustainability and beef cattle production topic, a farm resiliency, a secure beef supply, and then a 2021 market outlook, and many more topics. So if you're interested in any of that, please go ahead and check it out. We'd be happy to see you there. And then to put on your radar, we also hope to see you February 9th for our management of newly weaned calves in the feedlot with Dan Thompson from Iowa State University. There will also be BQA continuing education credits available for that presentation as well. So if you want to get your BQA continuing education credits, please register and we'll see you on the 9th.
Before everybody leaves, Dr. Hansen, our team was actually wondering if you could make a few comments about how much salt to include in the free choice loose mineral, or what might influence how much salt to include.
Yeah, that's a great question. So usually somewhere around maybe 20 to 25% is a good place for salt to be for free choice. So that's a good comparison to look at when comparing different labels for different free choice minerals. And again, you know, salt is kind of this tricky thing. When we have really high salt in things, we can limit feed. And when we have a little bit lower salt, we kind of give them just a little bit of a hint to it, right? And they want to come after it. So that's a good number to kind of look for on those mineral labels. For a 4 ounce mineral, just FYI.
Thanks. From the earlier poll, we asked if people were using blended or custom mix minerals or top dress, which led to a question I had. Are custom blend mineral mixes mostly used by larger herds and not so much for smaller herds? Does it cost so much to do custom blends that it prohibits their use with smaller herds?
Yeah, that's a great question. So I actually think custom blends have a ton of potential. One of them can be, you can actually be more strategic in what you want to spend your dollars on, because you can find a mineral program that maybe can be tailored better to your situation based on your feed analysis and what you need. But also you can think about situations where you might work with the neighbors, right? And so maybe if you want to buy mineral on a per ton basis, and you've got a couple of producers in your area that want to buy custom mineral together to kind of divide out that cost, I think that that's a great consideration to keep in mind. When you're just buying mineral from the farm store in a 50-pound bag basis, it is so much more expensive than it would be if you were trying to work with a local mill and do a custom mineral. There's just a lot of that money for the mineral program, or minerals that go to the middleman and the mixing in the middle and stuff. So that's something to keep in mind.
But with the custom blend, you should probably also be forage testing, right?
Well, the thing, I mean, forage testing, I think, is one of the #1 things that cow-calf producers, and, you know, testing our ingredients in the feedlot is important too. That's going to be really important to help you decide some of your strategies for things.
There was a late question here. I'm feeding with a TMR, all the bred cows. Can I mix mineral in with that instead of free choice?
Yeah, if you have the ability to mix accurately, that's usually the biggest thing, right? A lot of times cow-calf producers don't always have as much mixing equipment as we have available to us in the feedlot. If you can get an accurate mix, then every day of the week, I would rather have you force it into the TMR, than let the cow make that choice how much she wants to eat from the free choice mineral feeder.
We're getting lots of comments thanking you for your presentation, Stephanie, and you're a powerhouse. You were really good at answering questions. My hat is off to you. Thank you so much.
Happy to do it.
So we're at 8:31, and so we want to end on time, but, you know, if those of you want to stay on a little bit longer and keep drilling on Stephanie, you can do that, I think.
Otherwise, people are free to shoot me an email. I had my email on that last slide there. Otherwise, it's just slhansen@iastate.edu, and happy to try to get back to people.